Welcome to Akhand Vidyashram, the first institute of impeccable wisdom, the walking, talking encyclopedia. Mitral prolapse, the integrated human heart sounds and murmurs. My dharma, the impeccable wisdom, the wisdom of every perfect object. My greatest discovery, Devyank, the divine design of nature with which the perfect objects are designed and created. Devyank is the reward of 60 years of integrated education. Impeccable wisdom is enlightening. Akhand Vidya wisdom is empowering. My first mitral prolapse, 1984. In this series, the applied aspects of medical sciences in the light of Divyank is what I've started. And I talked about my first attack of panic way back in 1984 when I had experienced sudden temperature increase in blood pressure, heart rate, and went to Roypata Hospital, got myself investigated, and then settled down. After few months of occasional labile hypertension cases, I approached another professor of mine who was my teacher in Madras Medical College, and his name Dr. Chokalingam, and he recommended go through echocardiogram. So I went for echocardiogram, and what was disclosed was that I too have mitral prolapse at that particular stage. Why I got mitral prolapse at that stage, I have no idea. Nor am I sure what exactly it was, because it didn't really matter me much because I couldn't feel anything within my heart that much. But since I was diagnosed and it is associated with the first panic attack way back in 1984, which is 40 years ago, I thought I better make one more presentation of mitral prolapse along with normal heart sounds and the kind of murmurs which we can produce for the benefit of human society by and large. So now first understand what is mitral prolapse. Definition. Prolapse of the mitral valve. As I told you, the heart has got four chambers, two atrium, two ventricles. Atrium blood flows into the ventricles through tricuspid, this mitral valve on the left side, which is bicuspid, and tricuspid on the right side. This ratio of 2 and 3 is also in the Devyank ratio. Mitral is on the left side, from left atrium into left ventricle. That valve, which has got more blood pressure. Blood pressure in the left ventricle can be very high, can go up to 300 also. As a result, chances of breaking valve is much more if your heart rate is high, blood pressure is high, or the volume is high. That's the reason you got to understand how much load you can give it to the heart, what is the end diastolic blood pressure, what is the stroke volume. From that angle I've explained, if you can maintain your blood pressure 120/74, end diastolic volume 120 ml, and stroke volume 74, and ejection fraction of 61.8034%, and you are not suffering from any sympathetic activity, sudden prolapse, you can live perfectly healthy life for the rest of your life. From that angle, this is what prolapse is. Oxygenated blood from the left ventricle into the left atrium during the heart contraction is what prolapse is. This is one of the many common heart problems. Intensity of the blood returns defines the problem. We can reduce or eliminate the mitral prolapse fully. Fortunately, I did not bother about my mitral prolapse at that particular stage. But now, when I'm looking at the applied aspects of my own physical health, emotional, mental, spiritual, and integrated spiritual science life, I feel it's time for me to explain this, because this is not a condition which people by and large know. People know mitral heart attack, they know about other murmurs, but mitral prolapse is not spoken about distinctly. And for this, I am talking this as a concentration to focus mitral valve, blood from left ventricle into the right ventricle, because increased blood pressure or blood is to be explained. So I hope you understand why exactly I'm talking about this particular condition. To make people understand the flow of blood perfect human anatomy, 4 vital chambers and 4 vital sounds. Let's put it this way. Blood from heart goes to 100 trillion cells, and in 100 trillion cells you have body tissue systemic circulation come to stage when oxygen from blood is taken, used up for converting carbohydrate into carbon dioxide plus water, and carbon dioxide comes to the heart through inferior vena cava, and superior vena cava is what you can see as a blue color on the left side. Then blood flows back to the right atrium through the tricuspid valve, 3 cusps, to the right ventricle. From right ventricle goes through the pulmonary semilunar valve to the lungs, and in the lungs to the arteries to alveoli, where oxygen is taken from the atmosphere and absorbed into the blood when carbon dioxide is thrown. And I have told very clearly, blood pressure at systolic blood pressure at solar system at sea level is 160 mm of mercury, and alveolar level is 100, which is Deviank ratio. From that angle, then tissue blood, now you can see the red, which is oxygenated blood, blue is deoxygenated blood. So that's why this particular picture, so that you can understand. In lungs, it is absorption of oxygen, and in tissue fluids, it is utilization of oxygen to produce carbon dioxide. If that whole structure is understood, I think we are clear as far as perfect human anatomy is concerned, valves are concerned, chambers are concerned. So then we can proceed better to understand what these particular sounds are and what are their murmurs and how we can do things to make sure that we don't suffer from any one of them. So from that angle, this picture is very interesting. Now, in this particular picture, you can see the 4 chambers with 4 valves. Right on top, you can see pulmonary semilunar valve, you can write on top, then aortic valve, then bicuspid valve, which is mitral valve, and then tricuspid valve, which is 1. Mitral valve can be heard better in left atrium, which is almost the end of the heart, right at the bottom, the red color. Where the tricuspid is on the right side, you can hear. Whereas aortic is on the higher side, on the right side, towards the right side, whereas pulmonary is towards the left side. Mitral and tricuspid down, aortic and semilunar on top. So these are the 4 areas where we can hear the sounds much more clearly. So I hope I'm clear that the location of 4 sounds which we can hear is very distinctly prepared in this particular thing, and I'm sure no one has any problem with respect to these particular areas, and these are vital areas for murmur. What are different murmurs? We'll talk as we proceed. 4 human heart sounds, the vital location importance, let's understand. This particular picture is well accepted by everybody. So you can see right at the bottom, you have the first heart sounds. Right at the upper level, you can say aortic valve opening and aortic valve closing. That aortic valve, when it closes, is the time which produces the first heart sound. That means the mitral valve is closing. When mitral valve closes, that means your ventricular contraction has started. So that is the location which associates with ventricular contraction. But this particular picture is not as perfect I would like, but to understand things, it is associated with atrioventricular valve closure of mitral valve and tricuspid valve, which produces the first heart sound, which is very vibrant, and you can hear it better on the left atrium, almost 3 inches away from the center on the left side. Very prominent, very nice. Second heart sound, you can see, is the closure of aortic valve itself. That means the blood from left ventricle has flown into the aorta. After the ventricle stops contracting, blood cannot come back because aortic valve, which is there. We are talking about the left ventricle. We are not talking about right ventricle. since our focus is on mitral prolapse. So when that closes, you have the first heart sound. Second heart sound is at this particular juncture. First, as the closure of atrioventricular or mitral valve, and this is aortic valve. Hope you understand that when mitral valve closes is the first heart sound. When aortic valve from aorta back to ventricle, it should not come. When it closes, second sound. Third heart sound, right, as you can see, is the flow of blood from left atrium into the ventricles by force. And that is the third heart sound which is created. In this particular picture, there is no fourth sound available, but fourth sound is the contraction of the vehicles muscles of the ventricles. The lacunae muscles which contract, they produce a fourth sound, which is not very easy to understand, but I think that goes very well with we've just maybe halfway in between. I'm going to show you the picture as we proceed anyway. Now, in this particular picture, you can see the first sound, second sound, third sound, and fourth is not really shown here because it does not play much of important role with respect to diagnosis. But it is mitral valve curvature which produces contraction at that particular stage when ventricles start contracting before real contraction actually starts. Now, first heart sound, as you can see at A level, first heart sound is the closure of mitral valve. Second heart sound is the closure of aortic valve. Third is bringing of blood from left atrium into ventricles. And the fourth, you can see a small knot is actually the one when atrium contracts. When atrium contracts, it produces a sound which is fourth one. Third, when ventricles have stopped contracting and blood cannot flow anymore, AV valve opens up and the blood by dependency from atrium flows into ventricles automatically because a lot of blood is there. That flow of big blood amount flows into the ventricles is the third heart sound. And when it is pushed with the atrial systole is the fourth one. I'm sure now in this particular picture it's very clear what is the first heart sound, closure of AV valve. Second heart sound is AV valve, which is aorta and ventricles, that is closure. Blood flowing with a force from left atrium into the ventricle is the third sound. And fourth sound is when blood is pushed from the atrium into the ventricles with atrial contraction is that fourth sound. Now, having understood those four sounds which are normal, now let's go to the different problems which are created in different stages of different murmurs. Murmurs are artificial sounds which are normally not heard. But here you can now hear that, and how you see it and what it is, let's go one by one. First thing which comes to my mind is aortic stenosis. Stenosis means closure. That means between aorta and the ventricle, the aortic valve is the place which is stenosis. So as a result, blood which is flowing from ventricle into aorta, because the contraction is not able to push the way it should push, because it is not pushing the way it should push, they have to have extra force. As a result, you can have aortic stenosis as the condition coming up as the first thing, the first heart sound and first murmur. Hope is very clear. It is during aortic stenosis, the valve between aorta and left ventricle, during contraction of systolic ventricular contraction, a particular murmur takes place. I'm sure there should not be any difficulty for anybody to understand. This murmur comes when there is the aorta valve is not fully functional, closed, it's not as open fully as it should be. That's the result, whole blood. Since it's contracted, it's pushing through and producing this particular sound. Then mitral regurgitations is something which can be associated with mitral prolapse also. That means mitral valve is not as prominent, it's not closing completely. There can be prolapse which can lead to regurgitation, which to some extent is found in most of the people fairly well. But as long as it doesn't disturb the equilibrium, there is no problem. And that particular sound is also heard between first sound and second sound during ventricular contraction. Because it is not closing fully, like a mitral prolapse, it can go to regurgitation. Blood can flow into the atrium, but in a very small quantity, not a big quantity. So, second, mitral regurgitation, I think, has been explained pretty well. Then comes to the aortic regurgitation. Aortic valve, it cannot be closed fully. During ventricle, it is closed. When during ventricular diastolic phase, mean relaxation phase, blood can still flow from aorta into the heart, and as a result, it can produce murmur in the second part, which is during diastolic phase. The first two murmurs were during systolic phase of the ventricles. This is the first one, very ventricular diastolic phase. I am sure no one should have a difficulty in understanding aortic valve regurgitation is during ventricular diastole. Then mitral stenosis. Mitral valve, bicuspid valve on the left side is stenosed. As a result, blood cannot easily flow from atrium into the ventricles fully. It has to be pushed. As a result, you can see the murmurs, which are the late diastolic murmurs, whereas aortic regurgitation is fully diastolic murmur. Then you have patent ductus arteriosus, which produces pan-systolic murmurs. You can hear that sound during systole as well as diastole, and that's it. So from that angle, normal first heart sound, closure of mitral valve. AV valve is aortic valvular semilunar valve closure, which is also tricuspid valve, second one. Flow of blood from atrium into the ventricle, third. Fourth is by atrial contraction or systole. Then aortic stenosis during systolic phase. Mitral regurgitation during systolic phase. Aortic regurgitation during diastolic phase of the ventricles. Mitral stenosis during the later part of that, and pansystolic throughout. So I think from that angle, normal heart sounds, their locations, their concentration, where to see, and how to go about it, I think is well explained in this. So from that angle, I think as long as we keep our blood pressure 120/70, heart rate on 60 to 70, and keep diastolic pressure and have the autonomic nervous system fully under control, thou shalt have no difficulty in heart sounds, murmurs, whether it's the mitral prolapse or regurgitation or different things. Now let's understand. As I told you, the perfect cardiac cycle, if it follows all the things very clearly, the ratio of atrium is 1:7, ventricle is 3:5, and follows Deviank ratio, and we can maintain that 24/7 without any difficulty, keeping blood pressure in mind and diastolic volume, ejection fraction, everything as perfect as you expect. And it can be done by anyone who has suffered from heart attack, like me, who has suffered from prolapse, blood pressure. But today I don't have blood pressure, I don't have any, and I'm not taking any medicine also. And all I've done is to keep myself calm and quiet and eat what is normal, not eat what is not required. If you can follow that, you can lead a perfectly healthy, wealthy, wise, and happy life for as many years you want, as long as you are playing your roles very, very clearly. As I told you, this particular picture is the ECG which I want everybody to see as you grow older. If the same P, Q, R, S, T, U wave is maintained, it's no problem. So P wave is the third ventricle stage. Before that, could also be associated with fourth ventricle stage. QRS is primarily ventricular diastole phase, and right up to T you can go up to the second stage. And then comes the third stage, and then you could be the third and fourth stage. If once this stage is maintained, you'll have this particular picture even as you grow older, provided you keep your blood pressure, pulse rate, and everything under control. You lead a perfectly active physical, emotional, mental, spiritual, otherwise. You should have no problem whatsoever, and that is the objective of Akhand Vidyashram. And now, having suffered from all, today I don't have any problem, although I've grown older and older. Is there enough proof of the? Now, this particular slide is very important because the balance between autonomic nervous system is important, sympathetic and parasympathetic. And people who are having problem with heart, they should make sure that they maintain cranial parasympathetic system better than sympathetic. Let sympathetic come to as play a role in emergency as possible, not on day-to-day basis. If you can have the predominance of vagotomy, work toward to exercise to keep vagal pulse rate down, blood pressure down, ejection fraction down, and you will have no problem for the rest of your life to lead a perfectly healthy, wealthy, wise and the message to all the people around the world I have, I'm going by my own experience, you can avoid all the heart problems as you grow older, as long as you're taking food which is pure, vegetarian, sattvic, and also not getting used to drugs, not alcohol, not smoking, not non-vegetarian, any of those things which are unnatural. If you can avoid that and lead a perfectly healthy, you should have no problem as long as you want to live. That is the message of this particular. Now coming to the last one, discuss. Today I don't think we need to talk. I think we have done enough. As long as people can understand that this is how normal four heart sounds are. These are the locations, these are the considerations, and this is what is required to maintain your cardiac systolic blood pressure, cardiac output, and diastolic volume, blood pressure, etc. 24/7. You should have no problem for the rest of your life. And that is the objective of this particular thing. Having done that, let me only say thank you very much. It has been lovely sharing my own experience from the time in the last 40 years, how I have improved day by day to come to a stage. And that's it. If my life is an example, my work is an example, that if you are in tune with universal consciousness, you grow better, better and better as you grow older, because if you can maintain the physical health that way, emotional stability, mental, because the experience of so many years will help you to lead in a much better way. From that angle, it's been lovely sharing my experience of 40 years in this particular slide, and I think it's been lovely. Thank you very much. Thank you.